As Omicron loosens its grip on Northeast Ohio and COVID cases drop, we know a new variant could surface at any moment and quickly take its place.
Sure. Tonight, the CDC is strengthening its ability to sound the alarm about an emerging threat much earlier. News 5 anchor Mike Brookback now with how each flush of a toilet makes that all possible.
Right now, wastewater treatment facilities in 37 states, including Ohio, are playing a key role in tracking the prevalence of COVID-19.
The shedding in feces starts very early after someone is infected. It's in fact one of the first signs that we see of infection.
For the first time, the CDC is collecting all that data and including it in its COVID data tracker.
The advantage of this CDC-supported dashboard is that it allows you to compare data across states directly.
Here's why having that information is important. Dr. David Margolius with Metro Hospital tells me it's going to reveal community spikes sooner.
COVID wastewater definitely will give you a heads up earlier than other indicators like hospitalization rate, even testing, because it's just so dependent on the availability of tests in the community.
That extra heads up gives us all the chance to mask up, social distance, and rethink those high-risk plans.
The more tools that we have, the safer we'll all be.
Many states are sequencing wastewater samples to detect new strains of COVID-19.
That is a very powerful method for tracking variants of concern.
In addition to giving us an early warning a new wave may be on the way,
I'm glad we're putting our faith in the poop.
The CDC plans to use wastewater to keep tabs on outbreaks of other infectious diseases like E. coli, salmonella, and the flu.
The sky is the limit in terms of how this can be used as a public health tool, and it's a big, that's a big deal.
What started as a grassroots effort to track COVID cases in communities, now a national movement, as we enter what some call a new frontier of infectious disease.
We've already seen examples of cities and counties using their wastewater testing to better understand the trajectory of a surge of infections. Now more communities will have the opportunity to use this tool to help guide their public health decision-making.
400 wastewater testing sites are already online nationwide, with 250 more slated to join them, bolstering the effort.
The real power of this program will be more evident in the coming weeks when hundreds more testing sites will begin submitting data.
Reporting in Cleveland, Mike Brookbank, News 5.